Welcome back to NHS Hack Day in Cardiff. Coming into the early evening now, I'm with Yasmine Boudiaf, who has been working in VR. What project have you been working on, Yasmine?
Well, Chris and I have been using Unity to make an interactive 360-degree video that trains clinicians in clinician-patient interaction.
Very good. And how's that been going?
It's been a bit rough, and we spent many hours staring at a screen and having lots of technological issues, but we're getting there. So we're working on having an interactive interface so that somebody with a Gear VR headset can put it on and be able to look at somebody's face and detect what emotion they're expressing, and then, like, through a sort of gamification, kind of multiple choice interface, be able to say, okay, they are feeling upset, therefore this is what I should do, or they are feeling anxious, therefore that's what I should do.
And have you, I mean, you're doing some work in VR, that's you're doing projects.
Yeah.
Is this like an evolution of some of the things you're working on, or?
So far I've made virtual reality training videos that train in implicit bias, train against implicit bias in workplaces. And at the previous NHS Hack Day, I was speaking to a nurse who was having difficulty trying to get nurses and teenage patients to communicate effectively.
Yes.
And so together we were talking about, you know, how to bridge that gap of understanding between two groups of people who are quite different.
Yeah, that was Lottie at NHS Hack Day in London last springtime.
Yeah. So we were talking about doing something like this since.
And that's because you are not a stranger to NHS Hack Day.
No.
You were at the first one here in Cardiff in 2014. And how many more have you been to?
I've been to, I think, only a couple more.
Yeah.
And I don't know, here I am again, because it's always, you know, things actually get done here. And it's always such an inclusive and fun atmosphere, and I always end up learning something and taking it away with me and rolling with it. And it's always nice to be able to contribute something. So even though I can't code and I can't, you know, I don't know how to make hardware things, I can always contribute something.
Yeah. Absolutely. So is there any advice you would give to anybody that was thinking about coming to an NHS Hack Day?
The only advice is, don't think that it's only techies that are useful. Actually, we need patient groups, we need anybody working in the NHS. We just need concerned citizens that are willing to offer a bit of time. Creative people, just anyone who thinks that they can contribute positively should just turn up.
Yep. Everybody's welcome here,
Yeah.
and it's just really great to have everybody coming and joining in and making this community with us, and all of us trying to work on the same thing, which is improving care and health for people.
You meet all sorts of people here.
Yeah.
It's great.
Thank you very much for coming again and for chatting to me. It's brilliant to see you again.
Awesome, thank you.
Thank you.